All right, for your third position, you're actually going to stay on the bed if that's where you performed. The second position, just roll to your back. And there's a couple of keys to this one, and I'm going to explain the anatomy behind this after I show you the position, but really you want to sequence into this in a specific way. So you're going to start with both feet up, both knees up, and then you're actually going to hold around the right knee. The goal here is not to squeeze, but what happens when we pull this one forwards first, it prevents the pelvis from rolling out forwards when we drop the left one down, helps increase the stretch and the effectiveness of the mobilization. All right, so reach around, grab the knee, and then you're going to drop the left leg off. And this position, we're looking for a light stretch right here. This one's a little more subtle than some of the other ones, but when you drop the leg down, just let it accumulate a stretch, and this is going to be a 2-minute stay. All right, now these are some that we see have drastic impact on other joints when we start solving these rotational components. If you remember back to our explainer video of how these different connective tissues tie into the pelvis and then go into the other joints, they attach right on the front of the pelvis, and so when these two elements tend to move, it creates different length-tension relationships, and this is where we can get a lot of benefit out of solving this problem for other joints. All right, so what we're looking at here is the quads attached to the front of the hip right here and then below the knee, one quad in particular, the rectus femoris. And what happens when we hang the leg off and let it just stretch out with some gravity over a longer period of time, and remember this position is 2 minutes, it actually will start to draw the front of the pelvis back down. So typically what we see is that this half of the pelvis has actually rolled backwards, and some things we typically see out of that are some extra feelings of tension in the front of the hip. We actually, a lot of people have pain just below their butt on that side, or a little bit of almost kind of a crampy short feeling in the hamstring. And almost always, when people are experiencing low back pain, especially if it's associated with the pelvis, it's typically very low back and off to left or just off to the right. It's not dead center. And it's just like pinpoint. Yeah, it hurts right here. There's two little bony knots in the back of the spine, where if you find those, typically that's where pain associated with the pelvis tends to locate itself. All right, so you're going to hang out in this position for 2 minutes. Let that longer stretch kind of roll the pelvis back forwards just on the left. And then on the next video, we're actually going to sort out the opposite rotation on the right side. We'll see you there.